My name is Dr. Tara Iyengar, and I am one of the medical breast oncologists at Ironwood Cancer Research Centers. Today I'd like to talk to you about breast cancer and bone health. One of the most common issues women face as they get older is thinning of the bones. Mild thinning of the bones is referred to as osteopenia. When this progresses over time, it can lead to osteoporosis, which places them at increased risk for fractures. While 90% of women in the US will live 5 years or longer from the time of their diagnosis of breast cancer, there are long-term toxicities associated with treatment. Most of these treatments lead to further thinning of their bones and, unfortunately, osteoporosis. One of the most common treatments prescribed for patients with breast cancer is anti-estrogen therapy. This either lowers the estrogen levels in their body or blocks the effects of estrogen in their body. Even chemotherapy treatments in premenopausal women can lead to the onset of menopause at an earlier age and thus thinning of their bones. In order to diagnose bone loss, physicians often will order a bone density scan, or what's also called a DEXA scan. Prior to the initiation of treatment, patients often will obtain a baseline scan, which is then repeated every 1 to 2 years to assess the progression of this bone loss over time while they're undergoing treatment. To counteract the effects of the thinning of the bones, patients are told to take calcium and vitamin D supplements. But is there more that can be done? And the answer is yes. We have compounds called bisphosphonates and anti-rank ligand compounds to counteract the thinning effect on bones. In recent meta-analyses, these drugs have actually been shown to not only reduce fracture rates, but to reduce the recurrence of breast cancer in bone and improve overall survivorship from breast cancer. These results have been so groundbreaking that in the past year, the American Society for Clinical Oncology has actually made this a firm recommendation for all of our patients as part of their long-term treatment for breast cancer. But there are risks associated with these therapies. One of the most recognized risks is called osteonecrosis of the jaw, or ONJ. ONJ is the development of non-healing ulcerated tissue along the gum line. This is why prior to the initiation of treatment, patients are advised to go see their dentist for a medical clearance. During the course of treatment on these drugs, patients are told to monitor for signs and symptoms of any pain and sensitivity along the jawline. Any symptoms that are noted should be immediately brought to the attention of their dentist. The incidence rates of ONJ are rather low at approximately 0.7%, and most patients, once the treatment is stopped, will be able to have the effects reversed. It is evident that the interplay between bone health and breast cancer treatment is much more complicated than meets the eye, and the future looks bright for more progress in terms of treatment development. For more videos on breast cancer management and breast cancer health, please visit our website and our YouTube page. Thank you.